Hi guys, and welcome back to Lauren the Solution Live. I am sitting inside of Apex Studio, so before we do get started, I'd like to shout out our sponsors. This episode is sponsored by Apex Podcasting Solution. Your experience is our expertise, so if you are interested in starting your podcast journey, you can start with Apex Podcasting Solutions, and it's sitting inside this wonderful studio here. Is available for rent for you. So on today's episode, I am sitting with Dr. Angel White. She is a DNP and a family nurse practitioner. A lot of labels go behind her, but she is the owner and founder of A&S Healthcare. Welcome.
Hi. Thank you for having me. It's such a pleasure to be here.
Thank you for coming. So for those of the people out there, for the viewers that don't know you and don't know what you do and all your titles and accolades, you want to run it down to us. We got time.
So yes, my name is Dr. Angel White. I am a woman of many crowns. I am a doctoral prepared family nurse practitioner. I'm also completing my psychiatric mental health nurse practitioner certification.
Nice.
And also, I am the co-owner of A&S Healthcare. I own it along with my best friend, Dr. Shadae Booker-Shelton.
Nice.
I'm also the founder and president of Angels Helping Hands, which is a non-for-profit organization where we mentor the youth.
Love it.
And I'm also the founder and CEO of Angels Exclusive Creations. And that's just like an umbrella of actually 3 different things that I do under that particular business. I have a podcast.
Mm-hmm.
It's called Black Excellence in Healthcare, White Coats and Real Talk Podcast. I also do business and entrepreneurship life coaching, as well as I'm starting a nurse practitioner group this January called White Coat Powerhouse, where MPs run the room.
I love it. Go girl. Like, you killing it. You putting on for the black women. I really love that.
I'm trying.
You're doing it. You giving, and you're doing a lot for the community.
Yes.
So how did the journey start into nursing and advanced practice?
So ever since I've been a young child, I was always helping people, getting in trouble for giving people my clothes, spending my allowance money, feeding other people. So I always been like a server. So I already knew, like, very young on, I was like, I want to do what nurses do. I want to take care of people. You know, I want to be involved. And then my mom always said I had a big mouth. So I'm like, what
Shout out, Mom.
Right. What better way to utilize that big mouth?
That's right.
So very early on, I knew I wanted to go into nursing. And so when I graduated, I went straight through. I actually started off as a certified nursing assistant, then I just worked my way on up, and so I got my doctorate degree.
That's amazing. That's a lot of work that you put in.
Yes.
So can you explain to us, what is the APRN FPA? Because you're a full practice, you have full practice authority. What does the designation mean, and how has it impacted in ways like for your patients and for the community?
So it's an advanced practice registered nurse with full practice authority. Some states allow you to practice full practice without having a collaborative physician, without having a MD. So I can practice to my full extent on my own, which is a blessing in itself.
Yeah.
I wish more states will follow suit of that.
Right.
But the difference when you have an advanced practice registered nurse, when you become a nurse practitioner, it's a different role as opposed to being a regular bedside nurse. So now you are the provider. So now you're diagnosing. So now you giving orders, you're treating, you're prescribing, and you're doing all those things that's in the best interest of the patient to take care of that patient. So you got a whole lot of more responsibilities, and opposed to, like, if you was working for a job, it wouldn't be like a regular application. You get contracts, and if you break those contracts, you get fined.
Yeah.
So it's a whole different ball game, but it allows you to be more autonomous and work more autonomously. And now nurse practitioners, you know, they all starting their own businesses and doing their thing, and, you know, and really excelling out there and really changing the trajectory of healthcare, and which is awesome. And I'm just glad I'm a part of it.
I'm glad you're a part of it too. We need more of us in the community. So what made you go DNP versus PhD? Because one is like academic and one is hands-on bedside care.
Right. I'm very hands-on. PhD is just pretty much just doing the research. So it's like the background of things and finding out why you're doing the things that you're doing, which you learned that too in DNP as well. But I'm very hands-on. I gotta be out there in the field.
That's how I
with
am with anything I do. Like, I want to be there.
Yeah.
So because you did choose to be DNP versus PhD, it's more rewarding, right? So what is the best, like, accomplishment that you've had so far in being a DNP?
well, the best accomplishment is starting my own healthcare
That's
clinic.
right. That's big.
That is huge. And we established A&S Healthcare back in 2018. And just to see how it has grown, and just to see now we have like partnerships with different insurance companies and things like that. And just the patients that are happy. So I was in a lot of positions. I was in management positions, supervisory positions, in corporate America, pretty much on the healthcare side. And with them, it's more like they was treating patients like numbers as opposed to like people. So a lot of patients that come to my clinic and they see me, they be in tears, like nobody never sat down and really talked to me or discussed this with me or kind of just dismissed my symptoms or quick to throw me on a medication. That's not my first resort, is to putting you on a medication, because a lot of things can be changed with lifestyle. Right? So me spending extra time with my patients, I don't rush them. I don't give them a 15-minute visit like some jobs I used to work with in the past. So I see a lot of changes. I see better outcomes, and that just warms my heart. In itself.
Because we need more of us out there in the Black community, because we go to the physician sometime and tell them what we're experiencing, and they kind of brush it off. Just like recently, even when women are in labor, I used to work at a hospital, so when I was on the labor and delivery unit, when we come through the door, our pains aren't as extreme as the next person that come through the door. So to have someone at the forefront that knows, like, I don't think you're crazy. I understand, and we're gonna talk you through it and figure out the best remedy for it before assuming, oh, you need some medicine, you're sick, or you got a mental issue. So what would you say has been the biggest challenge throughout your career, either academically or in your practice?
The most challenging, I would say, throughout my career so far, is being underestimated. Sometimes people see you how you look on the outside, or sometimes just the color of our skin. And sometimes they be surprised when they see how competent and intelligent I am. And sometimes people, downplay you and dismiss you on certain opportunities because of that. So that's like what's kind of a challenge dealing with corporate America before I jumped into my own businesses and things like that. But it was all part of the journey. I needed to go through it.
And we all have to go through that. So mentioning that, the show is geared to help aspiring entrepreneurs, future entrepreneurs, right? So we want to definitely always highlight that there are going to be low moments. It's going to be challenging moments, but all of that is just, lessons and experience to lead you up to where you are now today. So by you having all that experience in the corporate world and different, fields that you worked in, areas, whether it was labor and delivery, mental health, how do you feel that helped you advance and where you are today?
All those trials and tribulations. It most definitely have helped me advance significantly, because when I started out my entrepreneur journey, I didn't have a mentor. And it wasn't too many people that had their own practices at that time. It wasn't too many Black women who had their practice at that time. And the ones that I did see, I would reach out to them. They didn't want to help. Which is very sad, but
it happens though.
And I feel like God put me, I had to go through that. Because now I don't gatekeep.
That's right.
I'm helping other people.
Yes.
I'm helping other people establish their businesses and things like that in healthcare. So, I tell people, you're not gonna stop nobody blessings.
By helping somebody.
That's
what God wants. He wants us to reach back.
You always supposed to, pay it forward and pull somebody up along the way. You get blessed abundantly, when you help others and be a blessing to others.
That is true.
I'm big on that. Gatekeeping ain't gonna solve.
It's not gonna do anything, because we all eventually, a lot of us gonna do the same thing, but it's okay, because what you bring to it, you're gonna. If I teach you this, I want you to add something more to what I taught you and make it bigger. So that would be the ultimate goal. So for the nurses out there that are thinking of probably branching off, starting their own practice, what would be the first steps that you would say they need to take?
Do it. No, but honestly, believe in yourself.
Yeah.
Like, believe in yourself. A lot of people suffer with the imposter syndrome, and they think like, oh, I can't do it, or it might be, yes, it's gonna be hard, it's gonna be challenging, but it's gonna be so rewarding. And use your resources. There are people out here that do love to help, like myself, that can help you not make the same mistakes that they once made, for those who started their journey. And I tell people who wants to start their own practice, you don't have to just say I'm gonna quit my job and then venture off. I mean, you can if you're in a financial position to do that, but I tell people start doing your research. What is it that you really want to do? What is it that you really want to offer? What is the impact that you want to put out there in the world?
That's right.
And then start just jotting things down, make a plan and set some goals, and don't feel like you're in a rush. This is your journey.
Yes.
So it's on your time, and just started like doing small things and building up to that, to where you are ready to venture off and start your own business.
So if you were to start this on your own, right, because you do have a partner, and I feel like in the world you kind of need somebody to get to where you want to go, because you can't do anything alone in the world, realistically, right?
That is true.
So how was it choosing a partner? Because fortunately for you, it's your best friend, and y'all went in the same direction. But
yes. A lot of people don't know that me and my best friend, we've been best friends since 11 years old.
Oh, wow.
And I always was interested in nursing and going into nursing. Actually, nursing is not her first career. Business is.
Okay.
So she went and got a business degree first. I always been passionate about and wanted to start my own business, because I just always kind of been the type that's been a leader and like want to do my own thing anyway. She gained the interest of going into nursing, and since she had a bachelor's in business already, so she did like a fast track program, and so she was able to get into it, and she fell in love with it like I told her she would. And so that was a blessing, and then she went all the way up to her doctorate.
Nice.
So it's actually someone I grew up with, who I've been best friends with since I was 11 years old. And I know that's not the story for everybody else, but I just been extremely blessed to have a best friend that's in this field with me, someone that I can trust, and someone that that can help. So we help each other. We got different perspectives on things, and things I'm like excelling in, like super good at, and things she's super good at. So it's really
balanced.
We balance each other out.
That's amazing, because it's hard to find.
Yeah, I have to kill it yet.
That's how me and my best friend is, though. But we are on a real estate group together. And it's like, I know sometimes like everyone has their differences, so it kind of balances it out. So it's definitely true. Yeah. So when seeking a business partner, for those that are looking to start a practice, and they definitely like, hey, I do need somebody, what are the things that you think the other person should seek for inside a partner that they're choosing?
Someone that moves with integrity. And I mean that in all aspects of their life, business-wise, professionally, personally, spiritually.
That's how I am, too. You got to align.
Someone who moves with integrity, someone that you can trust, and someone who's organized.
Yeah.
Someone who's organized, someone who got, good time management skills. Yeah. Because those things really play a part when you start a business and you want into business with someone. Because a lot of businesses fail due to, not being organized, due to, missing deadlines and things like that. Yeah. So those are some of the things, and y'all got to have respect for each other. Yeah. Y'all not going to agree on everything. Me and my business partner, we do not agree on everything. But we can always sit down and talk to each other like, I don't like that. Like, so you got to be able to, communicate with each other comfortably, even when the conversations is uncomfortable. Yeah. So, yeah.
And it's being able to have those uncomfortable conversations.
Yeah.
So absolutely. You guys started A&S Divine Healthcare. What inspired the creation for that business?
So, I used to do like home health nursing in the south side city of Chicago over east. And I actually had an older lady who I used to see all the time. And when I used to go visit her, she used to be like, it's just something about you. Like, you just have a wonderful spirit. And she used to call me her angel. And every time I seen her, we prayed. And she always say, whatever you thinking about, whatever you got going on, whatever you doing, it's always in divine order.
That's right.
So
I believe that.
So instantly when I started doing research on opening up my own medical practice and things like that, the word divine always stuck with me.
Yeah.
And then when my best friend was like, I'm down too, and I was like, okay, well, let's do this together then.
That's right.
And so that was exciting. So A stand for Angel and S stand for Shadae. So we just put the A&S in front of the Divine Healthcare. So that's how we came up with that name.
So there at that practice, you guys focus on mental health. You do physicals. You do it's an umbrella of everything there,
A lot
right?
of things, yes. We do primary care. We accept insurances. We accept out of pocket. We also have a direct primary care program where you can sign up for a membership to have access to us every month for those that don't have insurance. And we still have some people on that program who do have insurance, but they copay's too high.
Yeah.
We do urgent care. We do weight management.
Wow.
We do our own labs there. We precept nursing students because me and Dr. Shadae is both nursing professors, so we do teach at a university nursing too as well. And we do all types of sports, work, school physicals. We go off site, go to different schools and do their sports physicals.
Nice.
We teach CPR classes. We do IV hydration, body contour. It's like a one-stop shop. Mental health. It's like a one-stop
That's
shop.
amazing.
Yeah, because a lot of our patients, they come to us and they become spoiled.
Yeah.
And they was like, can you just do this? Can you just do this? So we try to make it a one-stop shop.
That's amazing.
Yeah.
Congratulations to you both.
Thank you.
Because we definitely need that in our communities.
Yes, we do.
So what was the gap that you saw between healthcare and our community that made you say, hey, I really got to get out here and represent for us?
Lack of education. And then them going to providers and being dismissed.
Yeah.
A lot of things that our Black and brown community, speak of or have symptoms of or complain about is very dismissive by a lot of providers. I'm saying, it hurts to say that, but it's the honest truth. It's the honest truth. And I just wanted to fill that gap. I don't want our community to be, dismissed or their symptoms, dismissed or they not cared for the way that they care for. And just the education part. Yeah. I feel like a lot of people in our community would do better when they have the knowledge.
Yeah, it's lack of knowing every time.
So you don't really have providers that would sit down and talk to you and it's really family oriented when you come into our clinic. Our patients feel like family. We sitting there, I want to get to know you so I can see how I can best help you.
Right.
So
versus going into an office and they just rushing you this, now they on Google. It's like I could have did this at home. You on Google.
Yes. And I tell people, Google not right all the time.
Now it's ChatGPT, so it's like, we going to misdiagnose ourselves every time.
You come to Dr. Angel, I got cancer. Where you get that from? Google? Now let's talk about this. Let's talk about this.
I'm like, Google said.
Yes. So it's just, filling that gap that's lacking when it comes to our Black and brown community.
That's amazing. So what does the general public misunderstand about nurse practitioners?
That we can do it all. Sometimes they be like, well, you're not the doctor. You mean like the medical doctor, because that's what the MD, a physician is. But, they be shocked to find that we do the exact same thing. We do, you come in here, you seeing us, just us, we're treating you, we're assessing you, we're giving you a diagnosis if that's, suitable, and we're prescribing you medications. We're doing the follow-ups. We're doing the education. So it just be a shock. They be like, oh my God, I didn't know y'all do all this. So I be getting called everything. Dr. Angel, Dr. Nurse. I got so many names that they call me. I answered all of them. I don't care.
That's amazing. So you are setting a non-traditional healthcare setting, right, for your practices. So how do you think that definitely builds a part of you building this empire that you're building with all these different facilities? Because people would rather go somewhere that's more home and warming versus a regular doctor, like a bigger brand name, right?
Yes.
So to work yourself up to that bigger brand name, what are the steps that you take in?
Honestly, it was word of mouth.
Yeah.
I get the most clients from word of mouth. I'm still trying to get a little better with posting for A&S Healthcare. But really, it's just being my true, authentic self. And, you know, it's kind of good, and they kind of love to see someone that look like them, you know. Sometimes they be timid and like, oh, okay, well, who is she and what's she going to do? But once you get in that room and we get to talking and conversating, they get to open up and telling me their whole life.
You their best friend now.
Yes.
Like, we friends.
Yes, I am. And it's just, you know, networking too. That is so huge.
It
like,
is.
people underestimate the power of networking.
That's how we met.
So, you know, it opens up so many opportunities. I tell people, like, me just networking has opened so many opportunities for me, way more than my degrees have.
Yeah.
Like, honestly, just getting out here, you know, talking to people, letting people know what it is that you do, what you offer, you know, and why do you bring value to, you know, what you do.
Yeah.
So that's important.
So you guys definitely bring a lot of value to the community. So far as the mental health side of it, like, what challenges have you seen in our community that are just, like, often not spoken about and definitely swept under the rug? Because we deal with a lot of that.
A lot of people in our community and part of a lot of our culture, we've been told to, you know, stick it out, tough it out. Nothing's wrong with you. Oh, you just go pray, take it to God.
Right.
You know? Yeah, you pray and take it to God. But you got to put some action behind that, too, as well. And just kind of, you know, I don't know about your upbringing. My upbringing, you know, mental health was kind of frowned upon.
Yeah.
You know, if
You was crazy.
you was crazy or something, you know, they ain't trying to hit black folks and parents, they ain't not trying to hit that. You crazy or nothing like that. You better get it together or you're going to get your butt whooped.
Right.
You know, so that's kind of how the upbringing was. So a lot of people is just like scared to speak out, scared to get help. So that's another thing that I try to stress and I try to talk about. And just because you need to talk to somebody does not mean
it don't
crazy.
make you crazy.
You know, and it's just being more aware and letting them know that, you know, it's a safe space.
Yeah, you got somebody to talk to.
Yeah, but a lot of people in our generations, no, they say just, you better pray.
Because that's how I was for a long time. I'm like, I don't want to talk to no therapist unless I find one that looks like me and that's been through what I've been through. Because other than that, it's like I don't feel like you can relate.
Right.
So for the people that you sit down with and they're like, you can't relate to me, how do you break that barrier?
Whew. I tell them, you might be right. I probably can't relate to you. But, you know, I do have a different perspective about it. And maybe, you know, that will help you see things a little differently. Because I know a lot of times people say, yeah, I want somebody to look like me to help me. Or that person don't understand because they don't look like me. But it's actually some experts out here, you know, that don't look like them that will be non-judgmental, will not be biased, you know, will really treat and help and not from a cultural standpoint because they don't know you. You know, they don't know your culture. They don't know your upbringing. So sometimes, you know, different perspectives works out very well for some people. I had a couple clients who was like, no, I just want to talk to somebody that looked like me and things like that. And that wasn't even working out. Yeah. That wasn't working out. But once they got somebody in a different ethnic group, they started seeing changes. And it did work out. So I tell people, you know, sometimes don't be so quick to just say, like, that person got to look like me. Right. Because it is some nice people out here that that's other ethnic groups that can help too as well.
Okay. So because you do have similar backgrounds to a lot of people that look like us that are in the communities that you're in because you're from the city, right? How has your background helped you or hindered you when even practicing mental health or just period?
So I would say more help than hinder because I could meet you at whatever level you want. Yeah. You know, so it don't always have to be, you know, me using all these
high terminology words, right?
And things like that, you know. So whatever level you at, I can meet you there, you know. And I think that's, you know, one of the great things about, you know, growing up in the neighborhood that I grew up in and being around the people that I grew up around is because I'm able to relate. I'm able to relate, you know, and I have some, you know, that kind of be a little rough on the edges, you know, I probably got to get a little rough with them just a little bit. Yeah. But that most definitely does help because they be like, oh, okay, so you do understand.
I understand.
They're like, you do understand.
And you're going to cut it out.
So that makes them a little more comfortable. Yeah. And then, you know, we started building that trust and relationship, so that makes them, you know, kind of trust me a little more.
For the experience, they walk into A&S Divine, right? What is that like for them? Because it is very family oriented, and it's a very close knit practice. So how is that?
So when you walk in A&S Divine Healthcare, it's very nice. It's very modern. The decor looks nice. You always gonna get high energy. You always gonna get high energy. Hey, how you doing? You're just gonna feel warm and welcome when you come in. I have snacks, water, and in the reception.
That's
area.
why they won't leave.
I never make. My patients don't wait long. I don't believe in that.
I love that.
I do not believe in that. You're not finna sit out there.
I love
30,
that.
40 minutes. No. So I'm like real strategic on how my patients are. Appointments are because I do not like to make them wait, and then I kind of space it out because I know most of them be wanting to talk or needing to talk. So when they come back, my medical assistant check them in, take their height and weight, get them ready for the room, and then when I walk in the room,
they ready.
They ready for me.
That's a good experience because going to the doctor, I know for myself and probably for other people out there, it's like, oh my God, I'm finna be here all day, and then now if they're there all day, it's because they want to be because you've made it so warm.
You should never have to. So many people say, I've been waiting an hour and this. I'm like, where you be going? Like that's not good. You supposed to. I respect people's time because I want them to respect my time. And you shouldn't go provider's office and have to wait that long. That's insane.
Agreed. So because you started in nursing, your best friend has the business aspect of it, right? She got the business degree. How do you think the transition from you going to working to actually starting your own business, like you entered the entrepreneurship side of it?
Ooh, that was tough. First of all, it was tough. Like, let me step out on faith for a second.
God, I'm trusting you.
You're right. I'm like, you gave me this vision, then come on. I'm gonna do the work to make it happen. It's just scared of the not knowing, and then. You're making a good, nice salary. Yeah. And so you're like, am I going to make the same amount? Am I going to make more? So
like, what's about to happen?
It's just, a lot of those things, just getting out of my own mind. Yeah. Just getting out of my own mind. But I most definitely believe in me, and I believe in the value and the service that I provide. And I was kind of preparing myself along the way because I already knew I wanted to open up my own medical practice. So I got in positions like supervisory positions, being a clinical director.
Yeah, learn every part of the business.
To learn the other side of the business and not just clinical. So that has helped me out significantly.
That's good.
When I started the business. Yeah.
So financially, right? What does it take financially to start a business, a nurse practitioner business? Because healthcare is a big industry.
Yes, it is. So it depends on what route you want to take, and it depends on what service you want to offer. So, it's been a blessing that me and my best friend, we actually paid cash for our property.
Nice.
So we don't have no mortgage, no lease. We just got
God is good.
Have property taxes. So it really depends on if you want to, buy something or if you want to rent something. It really just depends on your budget and your goals, but you could start small or you could rent out somebody's office or somebody's room and just to start building up your clientele until you're able to afford an actual space of your own. Yeah. Yeah, so it's a lot of money. That's why I tell people, don't quit your healthcare job just yet. Yeah. You can still work on things while you working your job.
Build it up.
Yeah, building up, saving up. And then, when you're in the right position, you make the move.
So what licenses come behind that?
Ooh. So you gotta get licensed with the state, and if it's a healthcare business, a medical business, you have to be registered under a PLLC and not just a LLC. So you have to have a professional limit liability company. You have to register with the board, especially if you're a nurse. So you have to get those registrations, those certificates in place, and of course, wherever city you go into, you got to get business certificate from them too. And if you're gonna have a lab, you got to get a certificate for the lab.
That's a lot.
So you got to have malpractice insurance, property insurance. It's a lot of things that you have to have in place legally that can be pretty expensive.
You gotta have your ducks in a row.
Yeah, you do, because you don't want to get in trouble. You don't want to jeopardize your license from not doing things the right way.
So it sounds like the insurance liability would be pretty high.
Yes. Yes, it is. Very high.
So what changes in the healthcare system do you hope to see? And how do you think your business and what you guys are doing that's contributing to the change?
The change that I want to see is, and I know I'm stretching hard with this one, is for healthcare providers to treat our Black and brown community like real people.
Amen.
And it's just not like the situation like with the pregnant lady, but it's not just like an OB and gynae.
Yeah, it's universal.
It's universal. It's like a lot of providers dismiss Black people.
Yeah.
A lot of providers dismiss their symptoms. A lot of providers don't educate Black people. A lot of providers just want to push pills on them.
Yeah.
Or a lot of providers think because if they saying they're in pain or something that they're a substance abuse user.
Right.
And they just drug seeking or something
Yeah.
like that. I just wish other providers, like I could give them an education on.
Yeah. It is. It's disturbing to see.
It is. It really is. And it's very sad. And that's why one of the reasons why I knew I had to do what I'm doing now. Because I'm not going to complain about the issues. I'm going to try to be a
I'm going to fix
solution.
them. Yeah.
Yeah.
That's amazing. Because I worked in healthcare, and even when I was in the emergency room, no matter what role you play in healthcare, that's a lot of trauma to see. To see us getting treated a certain kind of way and someone walks in with the same issues and you running to save their life versus one of us is disturbing. So what you're doing is definitely impactful on the community. What's the legacy and the impact that you want to leave behind? What's one thing you want them to know about Dr. Angel White?
She did it.
She did it.
She did it and she showed us.
That's all right.
She did it and she showed us. And I just want, people to see, like, people that look like you really can go all the way. Like, you really can pursue your dreams. You can really walk in the purpose that you feel like God put within you. You can do it.
Yep.
You absolutely could do it. I'm living proof, because I was a little bad little girl, just a little bit, but
same, but look we overcame it and
right,
listen.
So don't let your past and things that happen in your past stop your future.
And people that want to remind you of your past too.
Oh yeah, leave them alone.
Leave them alone and their thoughts. let it go.
Leave them alone. You got to surround yourself with like-minded people. Put yourself in rooms that you want to be in, or you say, I want to get to that level.
Yeah.
You got to network and put yourself in those particular rooms.
Yeah, your mindset will change once you get in there.
Will.
So you spoke about your mentorship program. You want to tell us about it? How can people look for it, or where can they find it?
So I mentor nurses, but I mentor the youth, which is that's something I'm really, really passionate about. So Angels Helping Hands, you can actually visit our website, angelshelpinghands.org, or you can follow us on Instagram at angels_helping_hands. If you want to volunteer, be a mentor, pour back into our youth, because it's really, really needed. Check us out. Check us out. Come help out. Come help out.
I'm going to have to come help out. Yes. I love helping the youth.
Yes, we do a lot of events and a lot of things in the community, and it's so needed. It's so needed. These kids need to see this.
It is, so they can have like real role models and women to look up to change the trajectory in the city, because
absolutely,
it's a lot going on.
Yeah, it is a lot.
So with all of that you have, inspiring the youth, your businesses, you and your partner growing, is there anything that you want to be like? What's the footprint that you want to be left known for?
The queen. No.
Period.
Powerhouse.
Period.
The powerhouse. I just really, the impact that I want to leave, the legacy that I want to leave, is just really just showing people what's capable.
Yeah.
What's possible. What you're capable of doing, and what's possible. And just knowing that I made a difference in so many people's lives.
Yeah.
Which is priceless.
It is.
You can't put no price tag on that.
You can't. You have anything coming up? Any events coming up?
Well, I have something from my mentorship program. We doing a vision board
nice.
event. That's December 7th. It is open to the public.
Okay.
So anybody interested, all you got to do is, email us. You go on our website, email us, or inbox me on Instagram if you're interested in attending. So that's one of the events that I have currently going on right now for the rest of this month. Then, it's then my birthday coming up.
Happy birthday. When your birthday? You're a Sagittarius?
December 14th, yes.
I love me a Sagittarius. I'm an Aries, but yeah.
Thank you.
What's your birthday plans? What's your birthday plans?
So I make 40.
Oh, wow.
I turn 40.
Well, you looking good,
Yes,
girl. Happy
thank
40th.
you. So I'm having a 40 Shades of Pink.
Nice.
Little birthday extravaganza that I'm kind of super excited about.
Well, I hope you enjoy your birthday.
Thank you.
I have to remember that date so I can sing something. Well, thank you for stopping by. I am going to drop all your tags, links, and websites in the description for these videos that we're making today.
Okay.
I do appreciate you keeping your commitment and sitting down with me.
Of course.
And
thank you for having me.
No problem. And for everyone watching, today we sat down with Dr. Angel White, owner and founder of A&S Healthcare, and you will be able to find her on all her social media platforms. If you are experiencing any mental health illnesses or issues that you think you may have, there's always someone to turn to, which is what we just heard today. So definitely click all the links, get the help you need. So yes. She's here. Well, that is the wrap up for our show. This is Lauren the Solution Live, and we are out.
Fine light in the beautiful sea.